Who else out there is dealing with spinal pain and had MRIs and they told you that your MRI?
The answer is a lot of people. But here's what most people don't know. In 2009, 10, somewhere in there was a large, actually, no, because it was before I was pregnant. So 2007, large hospital study published in the journal of, I think it was in Spine, actually, which is like the premier journal on spinal orthopedic injuries, published that showed 5,000 employees of a hospital system. They were all given what's called the Oswestry Disability Index and asked to complete the questionnaire. And then they were all given both a plain film, or what we traditionally call an x-ray, or they were given an MRI. And on report, the Oswestry measures report of disability. On the report of disability, 80% of people who reported absolutely zero disability, no pain, no restrictions in their job, no restrictions in their daily life, no inability to lift things, that kind of stuff. So they reported no disability to less than 20% disability. 80% of them had something wrong on an MRI. Of the people who reported 50% or more disability on that same questionnaire, only 20% of them had something actually wrong on an MRI. So in her comment section, I left a comment that says the MRI doesn't see pain, because it doesn't. And yes, having bone marrow that's a darker color can be significant, but I can also show you the pictures and give you, because physical therapists are trained in radiology, I can give you my assessment. There's nothing wrong on her MRI. And I'll show you that in a second. But the one finding of like an osseous hemangioma, basically she's had a bone bruise and it's created like an encapsulated bleeding area inside the bone, which can be significant, but it may not be significant for what she's presenting with as her pain, or they may not have known what they were looking for. And I personally would be having that followed up with something with contrast to see how quickly that is absorbing the contrast, because a osseous hemangioma, is it a hemangioma? Is it a tumor? This is her MRI. So there's a little bit of up here at this one, there's a little bit of disc thinning, but she still has plenty of space. The spinal cord has plenty of space. This darker part is the cord. The rest of this is the cerebrospinal fluid surrounding it. There may be an issue right there where that bone, that part of the lamina is touching the spinal cord, but as low as this is, it's probably not even touching the cord. It might be touching a nerve root, but otherwise, like this is a very healthy spine that we can see. So the radiologist's findings are accurate, and what the doctor reported to her is accurate. There's nothing on this MRI that would tell me what's causing your pain. And this is also why a good provider in treating pain isn't going to look at the MRI and decide to treat you based on the MRI, because when they do that, they usually miss something. So I've seen this happen in cases where I get clients who have a specific insurance that only allows them to go within a specific little framework of people, and on their MRI it shows that there's like a completely degenerated disc, but they've been doing PT for 6 months, they're not getting better, and they've failed conservative care, and so now they're being told that they're going to have to injections, and they're going to have neuroablation, and they're going to have this and that and that, and then the road eventually is surgery. And they come and see me, and I'm like, this isn't a disc injury. And they're like, okay, well, what is it? And I'm like, yeah, That would be sacroiliac dysfunction. Let's put you in a SI lock and see what happens. And sure enough, they get better. And I call the physical therapist at that specific facility and say, hey, can you actually treat this person for SI joint dysfunction so they can come back in network and not pay my out of network rate? And they say, no, I'm not allowed to, because all of my notes are seen by the surgeon and by the person who diagnosed them, and I'm not allowed to do anything outside their treatment plan. This is another way, like, people think, oh, I'm gonna get this test done and it's gonna tell me exactly what's wrong with me. I'm gonna get this MRI done and it's gonna tell me exactly what's wrong with me. And the truth is, 80% of the time we miss it. We still are missing it because we're not seeing the person in front of us. The other thing is that there could have been like an injury to a ligament, like a sprain in the spine. Like, that can absolutely happen, just like anywhere else, any other joint. You can sprain a ligament in the spine and then your body continues to perceive it as pain for a really long time because, unfortunately, you have genetics that don't allow your nervous system to calm back down all the way. And that there are people who are genetically more predisposed to pain and holding on to chronic pain, just like there are people genetically who experience no pain. And if you're not sure about that, go look up genetics, no pain. There's a whole documentary done on it. I think they've now found like 180 people who've never experienced pain in their life, and when they look at their genetics, it's because genetically that's reality for them. The things that could be done to help you are not just general pain management stuff. Obviously, you need to get that osseous hemangioma looked at. That would be a start. Because if that is the cause of the pain, like you had a bone bruise and it's encapsulated and the bone around it is deteriorating because all of your bones actually have nerve tissue as well, that needs to be looked at and determined what that actually is. But there could be things like peptides that actually help you and help reduce pain. And I'm not talking like GLP-1s. There are other peptides that can help you manage chronic pain that are not narcotics, that can help your system heal faster. And that would be worth looking into. I hope this video was helpful.